But you know, you make some good points, and some developed countries are using universal health care. Is that a viable plan here?
It could be, but I hear like in Canada, there are long waits. So even though everyone's covered, if you want a procedure, you might have to wait a year and a half, and I've heard that many Canadians come to America for surgery because the wait is too long.
Hmm.
So I guess the grass is always greener someplace else.
Yeah.
And I can't help but believe preventative care would be the best way of providing health care,
Yeah.
rather than waiting till someone's teeth fall out or they have poor eating habits that cause them to have certain diseases. Having them covered while they're young with preventative care, I think that's something that would be viable. But a lot of people don't choose to, they know what they should be doing, but they continue to smoke, as an example, or use drugs or something like that. And I don't know what the answer really is, other than it's nice to say universal health care,
Mm-hmm.
but if we bring in a lot of uninsured people who have very expensive care, I think that would increase the cost per person, and the people who aren't insured can't afford it right now, and the people who are insured are already paying a high premium already. So I don't know.
Well, I guess the one question I have for you is, if some of these people who had high medical costs, do you think that, like the prices you were talking about before in the hospitals, if they weren't so high for certain procedures, maybe it wouldn't be so expensive?
Well, I think the thing that bothers me, and it's a difficult choice, because if it was my son or daughter or a parent, maybe I'd feel differently too. But right now we have so many experimental drugs and experimental treatments.
Mm-hmm.
We have in vitro fertilization and all sorts of other procedures to make people pregnant who couldn't be pregnant before, and sometimes with multiple births or birth defects. And of course it's always difficult, and again it's hard to play God and say this one lives and this one doesn't. So, but today we have so many people that are alive on medical programs that are very expensive to upkeep, but they're not paying for it. The health plan is, and that health plan that's paying for it is made up of every member who's paying into it. So maybe my rates are going up 20% because some people have very expensive procedures which are costing $1 million or more a year, and they got to make up that money from someone.
God.
And I'm just wondering, to me, you have to look at the quality of life issues. And I think the doctor's Hippocratic oath is to keep everyone alive. So, for instance, I'm told you need to have a healthcare power of attorney to put yourself on life support if you're brain dead. But there was the case of this woman in Florida who tore her family apart, not because of what she did, but she had an accident or something that was on life support. A very tragic situation. I believe the husband wanted to pull the life system.
Is it Terry Schiavo?
Yes, it was Terry Schiavo. And other members didn't want to, so back and forth through the court battle it went. And all the time, the cost for her care had to be accelerating, paid by her estate or someone. And I'm just wondering, there's got to be an oversight system somewhere that says enough already. That it's much better to spend that kind of money on someone who has a long life to live, or you just have so many dollars to spend, and again it's difficult to play God and decide again who lives and who doesn't. But when you see that kind of abuse, it doesn't really help, I don't think, anybody. But here we live in a land of opportunity, but I think we pay the price of that too. The perception, whether it's true or not, is doctors are wealthy. They have lots of income, and of course they have a lot of training that they have to go through, and studying and expense to become the doctor that they are. But yet I think someone's profiting immensely when you read about, not just in the healthcare industry but other industries too, how the top CEOs are paid with, you know, like 500 million or whatever. I don't, just throwing a number out, but they're just astronomical, way beyond any expectation of income figure. And then you wonder why healthcare costs are as expensive as they are. There ought to be some kind of control on that from a public standard standpoint, rather, a national index. And I think premiums vary by state. So like long-term care is an example. People are aging a lot in America and having diseases they never had before because no one lived that long. The Alzheimer's, Parkinson's disease, all on the increase. Not because I don't think the genes were there all along. I think they were, but it's just because we're living longer. And when you look at these people need care, there are not enough care facilities. It's very expensive, like in Fremont where I work. The monthly cost is $4,000 to $5,000 for someone in long-term care. It doesn't have to be an old person. It could be someone with a motorcycle accident or someone with a brain hemorrhage or something that caused them to be paralyzed.
Gosh, and some people don't make that when they're working a salary like that.
Right, exactly. And without long-term care insurance, they couldn't afford, or they would spend down their estates, sell their home, or have to move to a more a less expensive place, like Nevada or Kansas or somewhere else for care. So it's hard to know. There's a lot of issues, but I think a lot of it with the cost of medical care comes from the drug prices being as high as they are, and different prices in different areas. For instance, the Canadian drug, same drug, Mexican drug.
What do you think, I mean, this may be a real simple question, of course, but why do you think these prices are so high?
Part of it is because healthcare plans sometimes have paid for those drugs, and there wasn't much resistance to paying for those drugs. Now most healthcare plans have drug policies where they pay only a copay or a percentage of the drug's cost, or they will encourage you to get a generic drug, which is supposed to be the same kind of drug. And my question is, well, then why is the generic so much less expensive than the name brand? But I guess that happens with almost every product. When you go to a drugstore or a supermarket like Safeway, you'll see the Safeway brand is usually less than, you know, a competitor's brand. But I'm told too that gasoline is the same gasoline no matter where it's pumped from, but every gas has a little bit different additives supposedly, or different price, you know, like I always use Chevron or I always use Shell or whatever. I think a lot of people today with the price of gas, they just go for the cheapest gas.
It's true, even if it's a penny cheaper, they'll go to it. It's kind of like a game for them.
Something, yeah.
Right.
But it's like the stock market. It's only going up, it seems.
And there's something strange about that, too. That's a whole other issue in that the stock market's going through the roof and the economy's slow.
Yeah,
so what's going on there?
You can't sell your house, and you wonder what's coming next. So.